Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Tre Tailor.
Fight the spread and take a stand against coronavirus. Wear a mask in public. Stay at least 6 feet apart from others. And get tested. Join us and fight the spread. Visit scdhec.gov/COVID-19.
With COVID and In It Together presents Wellness Wednesday from the Diabetes Advisory Council. I'm Tre Tailor, and today we're talking about African Americans and clinical trials, how we as African Americans can help find the cure to pretty much everything. To lead the conversation for leaders in this field, we're talking to Dr. Alexea Gaffney, also Mary Wilson, pharmacist Dr. Nanci Richburg, and also Dr. Edith Wilson. Ladies, thank you so much for joining us today.
Great to be here. Thank you so much for having us, Tre.
Absolutely. We're talking about busting down the myth of African Americans and clinical trials, and we'll do that coming up next on Coping with COVID. But first are COVID community updates. If you're mailing in your ballot, you must have a witness signature. The Supreme Court reinstated the requirement earlier this week after the lower court said it wasn't necessary due to COVID. Now, if you have already sent in your ballot unsigned, it will be counted. But for now, any mail-in ballot sent after today must have a witness signature. Now, as we mentioned on the show Saturday with the South Carolina Elections Commission, the witness signature can be anyone from anywhere, and it doesn't even have to be a registered voter. Another record high voting day in South Carolina as thousands across the state take advantage of early/absentee voting. Beginning today, satellite locations are open and any registered voter can cast their ballot at any of the locations throughout the state. Visit scvote.gov for more information or call the voter hotline at 866-687-8683. And USC is selling tickets to the remaining football games. Seats will be sold in pods to ensure social distancing for 3 upcoming games. The games against Auburn, which is homecoming October 17th, the Texas A&M on November 7th, and Missouri on November 21st. Finally, the VP debate between Kamala Harris and Mike Pence is tonight at 9 o'clock. You can watch it on almost any major network. Coping with COVID and In It Together present Wellness Wednesday from the Diabetes Advisory Council. Hey, don't forget that you can visit scdhec.gov and scroll at the bottom of the screen for information on COVID tests in and around South Carolina. Info is also going to be there throughout the show about organizing a COVID screening in your event or at your neighborhood. The DHEC Care Line also has information on testing and transportation if you need it to get a test. Now, Richland and Clarendon County paramedics are also doing in-home testing for anyone who can't get around or are immobile. You can call 911 for more information. You could win some cool prizes from the City of Columbia just for wearing your mask. Take a picture, post it to maskupcolumbiasc.com and get them, your family and friends to like it, and you could be a winner. It's maskupcolumbiasc.com. If you're having some challenges paying your rent or paying your mortgage due to COVID, the South Carolina Bar Association and SC Legal Services are offering a free toll-free number and website for rental and mortgage help. You can see the information right there on the screen, and it will be strolling throughout the show. And the City of Columbia is offering a 6-month payment plan for anyone who needs it. They also have payment assistance available. You can get your bill paid up to 75%. Contact the City of Columbia Water Bill Department for more information. And the South Carolina Department of Employment and Workforce is offering free courses and certifications in several fields, including business, technology, health, data science, arts, and humanities. Now, courses are offered in both English and Spanish. You can get information at do.sc.gov. The Richland County Democratic Party is hiring canvassers to leave information at folks' doors. The pay is $15 per hour, which includes training. You must be at least 18 years old, computer literate, and own a smartphone. Email executive director at richlandscdems.com. Website and phone numbers are also scrolling across the screen if you have information or need help about Domestic Violence Awareness Month. If you or someone you know needs help, please contact the Domestic Violence Hotline. Again, that information is on the screen. And Prisma Health is offering free flu shots at several locations. So it's so important to get one, especially now while COVID numbers are high. Please visit prismahealth.org. You can see that information. All of the information that I just talked about will be scrolling at the bottom of the screen throughout the show. Well, today, Coping with COVID is being streamed on the TaylorMade Productions page. Please go over there and like and share. Coping with COVID is also being streamed on the In It Together page. Please like and share that also for updates about living a healthy and productive lifestyle. We're also streaming live on YouTube. Please go over there and hit the share and subscribe button. And if you need more information and resources on diabetes prevention and management, please log on to inittogethersc.org. That's inittogethersc.org. Coping with COVID and Wellness Wednesday is brought to you by the Diabetes Advisory Council of South Carolina. And today we're talking about why it's so important for African Americans to participate in clinical trials. Dr. Alexea Gaffney is a New York-based infectious disease specialist and surgeon. Also, Mary Wilson joins us. She's a PhD candidate and project manager for the Nutritious Eating with Soul study at the University of South Carolina Arnold School of Public Health. And pharmacist Dr. Nanci Richburg is the Chief of Clinical Services at Salubrius Pharmacy. And we're also joined by Dr. Edith Williams. She is Associate Professor of Epidemiology at MUSC. Ladies, thank you so much for joining us today on Coping with COVID. I appreciate you.
Thank you for having me.
Absolutely. So we're all familiar, obviously, with the why African Americans are skeptical. And it goes back to the 40-year Tuskegee Project, which started as a good idea by Booker T. Washington back in 1895, of course, to African Americans with economic development. And then, of course, in 1926, for those who you may not know, when health was seen as a problem with advancement, especially syphilis, it kind of went downhill after that. And I'm just kind of summarizing, kind of everything that happened. Of course, when the study ended in 1972, those participants and their families were given financial restitution and lifelong health, medical, and dental benefits. And then, of course, in 1997, President Clinton formally apologized. Is that pretty much what happened? Ladies, do you want to kind of chime in?
Yeah, I mean, the experiment was to see what would happen when they let syphilis naturally progress. So while people were getting cured and treated for syphilis, which is literally plain old boring penicillin, these poor gentlemen were observed to go through all of the devastating effects of this infection. So, I mean, if you want to call it a trial, it was an observational trial. Just watch and see what happens without any intervention. But we don't do those kinds of trials anymore.
Yeah.
Once a standard of care has been established for any disease or medical condition, any subsequent clinical trials have to be compared to the standard of care. So you have to sort of at least get that plus something typically. And so we don't necessarily do those particular kinds of observational trials anymore. But yeah, that was devastating to watch these men experience, not that I saw it, but I'm just saying, watch these men experience mental
health.
Well,
I was going to say, girl, if you were back in 1895, you look amazing. Look, black don't crack. I mean, that's...
But that's the thing, right? So we weren't there, but we are all fully aware and understand what happened during that clinical trial. And so I think every Black person in this country and person of color goes into the doctor's office in general already concerned, are they experimenting on me? People think that about teaching hospitals. And when women are approached about clinical trials, and I'm just speaking to women specifically because I'm a breast cancer survivor and I work with that population, particularly women of color and those who have been approached by their healthcare systems or cancer centers to enroll in clinical trials, their gut response was, I don't want them experimenting on me. Oh, they think because I'm a Black woman, they can just mess over me and, treat me like I'm some sort of lab animal. I know what they did in the Tuskegee experiment, and I'm not here for it. So we're not part of the trials, and we don't get to benefit from cutting edge therapy. We don't know how medications will affect us differently or not compared to our white counterparts. And so just using breast cancer as an example, we don't know if our 40% higher mortality rate is due to the fact that medications may impact us differently or may not be metabolized or processed the same for us, or is it all the other socioeconomic factors plus that? So it's a huge issue for us not to be involved. And so I'm grateful that we're having this conversation with women who look like us, who we can relate to, who have the expertise to have the conversation, so we can, help ourselves and get the help that we need and keep our health on track.
Yeah, you're absolutely right, Dr. Alexea. Thank you. And Deborah Abraham says, she says, I'm loving this panel of sisters, professionals. Yeah. And I was excited when we were able to get, these women on because one, it is definitely affecting us as African-American. And because if we as sisters, can dispel the rumor, if we as sisters can learn to trust, and as sisters we can tell other sisters, then of course we can influence our brothers who, again, it's like, pulling teeth, so to speak, to get them to even cut their fingernails, more or less, go to the doctor. Your feet stink, you need to put some athletic foot powder on your feet. You know what I'm saying? So I am too, glad that we're having the conversation. So do you guys feel like, and we're going to bring Dr. Richburg back in. I think she dropped out. Thanks, Dr. Richburg, for joining us again.
Yeah, sorry.
No, it's all good. So can people now trust trials and studies?
I would say yes. And one of the main reasons is because now we have, after all of the incidents of that resulted in mistrust, we have what we call the Institutional Review Board. And their job is to regulate research studies with human subjects. And so they are responsible for reviewing research study protocols before they are put into place. Research staff who are working with these research studies, they are mandated to complete training through the Institutional Review Board. And prior to putting any study and granting approval for it to be in place, they also have to do a risk-benefit analysis, where they look at the risks for participants and also the potential benefits. And if the risks, if the ratio concludes that it outweighs any potential benefits, the IRB will shut the research study down. They will not approve it. And so that is a safety mechanism in place for anybody who is interested or thinking or considering participating in a clinical trial. Not a lot of people know that that is happening behind the scenes. And so if a research study is approved, just know that the Institutional Review Board at these institutions have granted that approval and have deemed it safe for participants to safely be a part of that research study or that clinical trial.
Right. That's Mary Wilson with USC. Dr. Richburg, I saw you over there shaking your head. You say what?
Yes.
Oh, Lord, we've lost her. You're frozen, Dr. Richburg. Dr. Williams, do you want to chime in on this?
I actually was just going to share a lot of the statements that Mary shared. That's absolutely correct. A lot of times as investigators, it can be kind of cumbersome for us, and we're forced to jump through a lot of hoops that sometimes can be very frustrating, even things as trivial as adding an instrument to ask questions of participants.
Oh, wow.
But all of that is in place to make sure that participants are completely protected, that they are comprehensively informed of everything that is going to happen to them, and that they understand that at any point they can withdraw, who they can contact if they have concerns. So all of these things are addressed by those requirements that are put in place by the Institutional Review Board at the different institutions. And like Mary said, a lot of people don't know about that. They don't see that process,
Right,
but it
right.
can be lengthy. It can be very intensive to make sure that people are safe and protected.
And so do trial and study participants know that information going in, that they have the opportunity to, to report, so to speak, if they don't feel like they are being treated fairly or justly?
Yes, we are required to develop informed consent forms and have people signed consent, or in some different studies you can have assent or verbal consent, but you always have to have some type of documentation in place of how you plan to get the consent, the informed consent of people participating in your studies. And that's very structured as well. There's specific information that needs to be included. A lot of times there's regulatory language that you have to include with your study description. And then there's always contact information that's provided so that people can reach out, not just to you as the leader of a given study, but also institutional contacts, and sometimes state and federal contacts if they don't feel comfortable approaching the investigator on the study.
Is it still challenging to get people interested in these studies and trials, ladies?
Absolutely.
Most definitely. Most definitely.
Yeah. And is it still because of, the trepidation people have based on, this one tragic incident?
Well, it's not the only incident, but it is medical mistrust. And, apart from that particular trial, people know of the story of Henrietta Lacks, where the medical community took her cells and profited billions and billions and billions of dollars and still use her cells. And it's only by accident her family found out what they did with her cells and finally got compensated. And then, there's been trials done on prison inmates in the past. And so there's so many incidences that cause this, on top of, we have current medical mistrust, right? We get insufficient care, inadequate care. We don't get the same outcomes as our white counterparts. Look at the maternal morbidity and mortality that Black women experience. Look at infant mortality and morbidity that Black families experience. And so it's an ongoing mistrust. So it is understandable. And I think there's a responsibility for any sort of research or clinical trials team to address that when they're asking them to enroll in trials.
Right. And I'll comment too. And so from the research that I'm working on with the Nutritious Eating with Soul study, usually the venue in which we have these conversations is during the recruitment process as well as orientations. And so we just don't go from asking people to participate in a study to then having them sign an informed consent. There are multiple contacts that we have in place. We do a questionnaire that they have to submit online. From there, we have a follow-up one-on-one phone call interview where we talk a little bit more about the study. That way they understand fully what it is that they are interested in, what they're signing up for. After that, we then also have a pre-orientation and then an orientation. So there are several levels of contact involved before we just approach someone about a study and then getting them to sign an informed consent to begin the study. And so definitely, like Dr. Alexea said, we have a responsibility. A lot of that responsibility falls on the people that they're going to see in the public who's reaching out, whoever's in charge of recruitment. It's important to have a level of trust with the community. Me as a Black woman working with African-American participants, we naturally and automatically have something in common that we can relate to. However, if I had a white counterpart going out into the African-American communities that we're trying to reach and discussing with them a research study that is for African-Americans, there is going to be a level of skepticism involved. Okay, I don't really know you. What is happening here? Why are you approaching me? And so I think it's important for investigators and for researchers to understand that there is a level of trust that has to be obtained first. And so it's very important of who you're selecting to be out on the front lines. It's very important for all of the hires involved in these research studies and clinical trials, because people want to know that they have somebody in their corner, just historically, as we discussed. And I can take it back even further. We can talk about how slavery has also impacted the trust factor. And so, that is a must in order to properly recruit participants and recruit African Americans. You have to have that trust, and it's going to take somebody, a familiar face, somebody from the community, who they see, who they know, who, oh, I know her grandma now, it matters. And so that is a responsibility of the investigators, and one that I think should be more apparent and acted upon in a lot of institutions.
Well, you're talking about recruitment, and that's exactly where I was going to go, Mary, to recruitment. But before I ask how recruitment is done, to your point, do researchers, the powers that be, whoever are putting together these trials, these studies, recognize what you said, Mary, that it's important that the folks that are doing the recruitment have that level of trust, look like who they are recruiting? Is that being done? Edith, do you want to jump in?
Sure, I'd love to jump in. I know that I would hope that everyone has this in the back of their mind. I know there is a lot of scientific literature to that point. Something that I've done personally in my research, because of my understanding of the deep distrust of the medical community, particularly where I live in Charleston, South Carolina, that I intentionally placed my picture and photos of my study team, who are largely African American females, in our recruitment letters, so that when these ladies see this, see the letterhead coming from the Medical University of South Carolina, they also see that I, as an individual, as an African American woman, am leading this program of study. And I've seen really positive response from that, just having an image of who they will be working with and who is asking them to participate. That makes a huge difference. And I know in grant applications, we actually cite that we will have a diverse group of on our study team. We will have underrepresented females and males in some studies as part of our staff reaching out to the community. So we make that known, because in the broader scientific community, I'm sure many understand that it can be a barrier.
Yeah, that's Dr. Edith Williams. She's Associate Professor of Epidemiology at MUSC. Mary Wilson with USC's New Soul Study also joins us. And Mary, Victoria Dixon Mokiba says that your group over there at USC does a fabulous job with recruitment, forming trust, and building relationships. Thank you, Victoria, for your comment. Awesome. So, Dr. Gaffney, how is recruitment done?
So I'll use the Cancer Center as an example, but this could be any center. It could be, an HIV center, or you think of a cardiac center, any medical condition, if we're speaking specifically to medical research. And usually there is a research team who is kind of available on hand when they're actively recruiting patients to participate in trials. And usually the doctor will identify a patient as someone who may be qualified to be in the clinical study, and they'll ask the patient, would they be okay if the clinical trial team comes and talks to them? Just because you might be a candidate doesn't mean you'll be enrolled. And so it could be multiple trials. It could be one trial. It could be, again, observational trials. We just want to watch certain things over the course of your treatment. We want you to fill out questionnaires. Research doesn't always involve an experimental drug or treatment. Sometimes it could just be a bunch of questionnaires as to how you tolerated a treatment that's already in existence, or how adding a certain intervention like counseling, it could be nutrition counseling, it could be exercise counseling. It could be so many different types of interventions that are being studied. And then someone from a research team, a recruiter from the research team, would come and do an interview, ask more questions, get more information to see if you qualify for a trial. So when I was treated for breast cancer, I was introduced to the possibility of being in 3 different clinical trials, one of them which was sort of an observational trial, but it did require me to get non-invasive imaging of my heart. And that was, of the 3 trials, that was the one I was able to enter into. And we have to remember, the trials can benefit us. My trial benefited me in that it identified a serious adverse reaction to my medicine, and I was able to see additional subspecialists on a more regular basis to get intervention for that. There was otherwise no change or diversion from the standard of care. So I still got the standard of care treatment. I got extra studies and extra doctor, and it ended up benefiting me. And so we have to remember that there can be lots of great potential benefits for it. So you'd meet with a recruiter from the trial. They would be allowed access, typically access to information, labs, imaging, etc., in your medical records, if it's that kind of a trial. And then if you are recruited or enrolled into the trial, then they would introduce you to what the medication is, what the intervention is, what are risk and benefits, as was mentioned before. And, is it a placebo control trial, which means you might get the intervention or you might get the medication or you might not, right? And they would explain all of that process to you, and you would be required typically to report back side effects, adverse reactions, etc., that you experience, and maybe do extra testing, imaging, and you'd have to know the risk and benefits of all of that. So it's extremely detailed. I think it is, handled very well. It has to be, you can't mess around. These are sometimes cutting edge therapies. These are life-saving interventions, and they can literally reshape, if it's a medical trial, reshape how we treat a particular disease and change the standard of care. And so it really has to be taken very seriously.
That's Dr. Alexea Gaffney. She is an infectious disease specialist and surgeon in the New York State area. So, Mary, because I live in Columbia, South Carolina, where you live, I know that at least for the New Soul survey that you are project manager of, you guys go to Black radio and listen. Black radio is where Black people are. If we're trying to get Black folks, African Americans are the demographic with the largest radio listening numbers. So I know that's something that you guys do. How has that worked for you?
Well, so with the radio, honestly, that is where we did an analysis of where we were able to recruit from, percentage wise, and the radio recruitment ads that we ran for our study, we received the highest level of people or feedback of people responding, indicating interest in the study because they heard it on the radio.
Right.
So definitely, we're out there listening, and we were on several different channels on the radio station. And so it worked out really well. A lot of people, they have their set show hosts that they like to listen to every single day, and they're faithful. And so if you can get on that show and get a spot, know that you will have a lot of listeners out there.
Yeah. Now, Dr. Williams, what about you? Is social media a viable way to recruit African Americans? Because a lot of African Americans, there's a huge social media audience.
Yes, absolutely.
A lot of people get their news and information from social media. Yeah.
Yes, absolutely. And I was going to add that.
Go ahead.
I'm sorry if I interrupted you.
You were saying social media?
Yes. Sorry if I'm breaking up. Am I breaking up? Or you can, okay.
You're fine.
I was going to add that recruitment for trials is very targeted. Generally, you're looking for specific folks. So you're looking for people of a certain demographic, either age-wise, race sometimes, also if they have a certain condition. Or they've been exposed in a certain way. So investigators will generally try to go where their people are, to go where that audience is going to be. And social media is a very powerful tool. We have a lot of research now in the scientific literature showing that particularly minorities and particularly females get a lot of their health information from social media platforms. So it is a very, there's more and more evidence that it's a very useful tool in recruiting participants. I know outside of radio, other investigators have tried to form relationships with faith-based communities to try to get the messages out about different opportunities that way. And then I know personally with my own research, I do a lot of research in lupus patients. So I try to go to where the lupus patients are. So I'm going to rheumatology practices, I'm going to lupus clinics, I'm going to different lupus focused events. And actually getting the word out about the research that we're doing that way, because I know that's where my people are going to be.
Right. That's Dr. Edith Williams. She's the Associate Professor of Epidemiology at the Medical University of South Carolina. Dr. Alexea Gaffney joins us also. She's an infectious disease specialist and surgeon in the New York area and a PhD candidate and project manager for the Nutritious Eating with Soul study at USC's Arnold School of Public Health. Mary Wilson joins us also. And we're talking about African Americans and clinical trials. And when we come back, we'll talk about why it is so important for us as African Americans to participate. And we'll talk about what these ladies are working on. That's coming up next on Coping with COVID. I'm Tre Tailor.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Tre Tailor.
This flu season arrives during the COVID-19 pandemic. Groups at risk for serious illness from COVID-19 and flu are similar, but complications from flu are much higher in young children. Everyone over 6 months of age should get a flu shot to help prevent more illnesses, hospitalizations, and deaths in South Carolina.
The flu is not just a cold. Each year, many South Carolinians are hospitalized from the flu and even die.
Getting the flu vaccine is the best protection against the flu for everyone in your family.
The flu vaccine is safe, effective, and does not cause the flu.
You can make a difference this flu season by protecting yourself from the flu. It's important that I protect my baby.
It's important that we protect our families.
It's important that we protect our schools.
And our students.
It's important.
It's important.
It's important.
It's important that we protect our state.
Talk to your healthcare provider, pharmacist, or health department about the flu vaccine today.
I'm Tre Tailor, and Coping with COVID and In It Together presents Wellness Wednesday from the Diabetes Advisory Council. Today, we're talking about the importance of African Americans participating in clinical trials. And we've got Mary Wilson with the University of South Carolina School of Public Health. She's working on the New Soul study. Also, Dr. Edith Williams is Associate Professor of Epidemiology at the Medical University of South Carolina. And we'll talk to her in just a minute about what she's working on. And Dr. Alexea Gaffney is an infectious disease specialist in the state of New York. And I think we've got Nanci Richburg back with us for a minute. And Nanci, I'm going to ask you right now what you're doing so that we can get you in here before we lose you.
Well, I have a signal. Thank you for your patience. We're working with DHEC and In It Together for the Diabetes National Prevention Program. So we're located in the upstate, but our program is both full statewide as well as nationally. And it's a year-long program, and it's really great right now. We're using a Zoom format, and people are enjoying it. They like the time. We've already lost in this particular cohort 30 pounds among them, and we're on week 12. We've increased exercise minutes, and we go through the process and really reinforce it over time in a group setting as we're directing it and learning. So I think it's a great opportunity to prevent progressing to diabetes, which we also know is a risk factor for COVID. So getting the weight down, changing our eating habits, and noticing how to read labels and how to understand what they mean for us is important, and that's what we're doing.
How many people are in your study?
Right now, we have 10 people going through our initial cohort as we're going for our recognition. We are recognized by the CDC, but we're going to be certified. We look for 15 to 20 people in each cycle. That's a great number because we use the breakout rooms and for them to talk with each other and experience different things. Our next cycle is starting the last 2 weeks. So each week we're starting the cycle in October. And if they go to our website that I posted in your link, they can go ahead, sign up, and we talk with them to see where they are. Our big thing is that we like to meet people where they are and help them to achieve the best health that they can. And this is something that's really important. We have a gentleman that thought he was doing great by eating soup. Unfortunately, he chose chicken chowder soup, and he was eating 3 cans a day. And when we finally introduced him to the concept of reading the nutritional label, he didn't realize how many grams of fat, carbohydrates that he was intaking as he ate that soup. And he said it wasn't even fit to give away anymore, but he changed his process, and he's already lost 12 pounds in this process, just him alone. And it's been a really good effect for him. He's even seen his blood pressure come down.
Wow. That's great. So you mentioned, and this is a whole kind of a different topic. So he's eating chicken chowder soup. So that's one that's milk-based. So that's one problem.
And it's high in milk, high in cream. It's not even just milk. It's heavy cream that's used in chowder. So getting him to a more brothy soup, as well as learning how to make soup. We have weeks as we progress on where we have specialists come on. So I'll have a chef that comes on that talks about improving how you cook. We have people that say, I'm a foodie. I want to eat good food. I don't want to eat alfalfa. And we introduce them to different foods and show them how delicious they can be. And it's a great concept, as well as exercising. People that were couch potatoes, they weren't walking maybe to the mailbox, and now we have them up to 3 miles. And it's a group effort. We have dance-off contests, so we keep it fun. But it's a great program and a great platform that's nationally recognized. And most people lose 5 to 7% of their body fat over the course of the program.
Awesome. So your email address and your company's email address is here. Is this how people contact you about the study? Absolutely. Great. That's great.
Yes, they can.
And you're still looking for people for the next cohort, right?
Yes, we're looking for 5 people for one cohort. That's our local group. We no longer have to meet in person because of COVID. They're allowing us to do it all online. But we're doing a hybrid where you can come on site. We're located in Powdersville, South Carolina, but we have a lot of people that prefer to stay in the home, and we can just do them all right online, and we mail out different things and prizes, and we share that. So we need 5 more for that particular cohort, and we're looking for an additional 15 for a new cohort that we're putting together. And we're doing this in conjunction with DHEC, and they are funding and providing this to South Carolinians for free. I'll be able to provide this program for free. So if it's a cost issue, that's something that doesn't have to be worried about.
So what are the requirements, Nanci?
Well, if you go to our site, or if you go into doihaveprediabetes.org, you can take the prediabetes risk assessment test. So you can self-refer yourself. Your doctor can. If your doctor has ever told you that you have prediabetes, you are qualified for this program. If you had gestational diabetes while you were pregnant, that would qualify you also for the program. If you have an A1C that is above 5.7, you actually qualify for this program as well. If you have ever had an issue with your weight, if you are overweight or obese, or if you know your BMI and you're over 25 on your BMI, you also qualify. But if they call us, we can go ahead and go through those risk factors with them. And we have other programs for people who are borderline that might not qualify for this program, but we still want to help them to achieve their best healthy state.
Awesome. Awesome. That's great. Ladies, thank you for my patience. I just wanted to get her in there just in case she.
Yeah, we never know.
Yeah, thank you so much, Dr. Richburg, for that
Thank you for that.
I want to find out what each of you are working on also, and then I want to talk about, to wrap up the conversation today, why it's important for African Americans to participate in trials. So, Mary, I know that you're with the New Soul study. Tell us about that.
Yes, so the New Soul study, it is a study that is focused on heart disease prevention in African Americans. Nutrition is one of the primary contributors to heart disease. And for African Americans, heart disease has been the leading cause of death for 95 years.
Wow.
That's unacceptable. And talking about health disparities, more African Americans, like I said, die every year from heart disease alone. That outweighs cancer, and any other medical condition. And so what the New Soul study, what our goal is to do it is a randomized control trial, which is also a research study where we are looking at comparing two diets. And one is a vegan plant-based diet that participants are assigned to for 2 years. And the other is a low-fat omnivorous diet where they can have some animal products. And they also in that study, and that assigned to that group for 2 years, we're comparing the two to look at how much weight loss is happening between the two groups. What is their blood pressure doing over the course of those 2 years? Is their cholesterol coming down? How much is it coming down? So we're looking at a variety of factors, which makes this a clinical trial because it is a clinical aspect. We are taking their measurements along the course of the study. And so we have just concluded with our first cohort that had 67 participants. And we are also finishing up next year with our second cohort of 92 participants. And so over the course of the study, we offer nutrition intervention classes. They're all being done by Zoom now. And so we have guest chefs who come in and do cooking demos. We talk about reading food labels. We also talk about successes and challenges and what challenges are you facing as you are changing your lifestyle. And, that includes family challenges, that includes, challenges with your social life. And we also explore stress management as a part of the study and physical activity. And so with the physical activity, we're just going by the guidelines. We're asking folks to do 120 to 150 minutes of activity each week. And so that sounds like a lot. So a large part of the study, we're focusing on changing the mindset because you have, 168 hours in a week. And really, we're only asking you to follow the guidelines and do 2 to 2.5 hours of physical activity every week. When you change your mindset and think of it in that way, it doesn't seem like a lot. That's less than 10%. That's less than what they ask you for at church.
Right.
So, we can
people don't want to give that, but I digress.
Yes. So, with the study, we have now also received a diversity supplement from the National Institutes of Health, who is funding our study, and we're rolling it out in the community. So our first rollout is actually happening now with a local vegan restaurant, Rare Variety Cafe in Columbia, South Carolina. And so we have started with that group, and we are now recruiting for our second cohort of the community rollout, which is a 12-week modified version of the 2-year study. And we are looking for more men. So that is my plug for recruitment right now. We're looking for more men because as we're discussing, it is very important for African Americans to participate in research studies, clinical trials, but it's also even more important that we get men in there as well. Because heart disease is killing both our men and our women. And so we definitely need to have the representation of the men as a part of these studies. And so, there are factors associated with recruitment, and our website was scrolling on the screen as well. But if you visit newsoul.org, you can get more information about the study and also how to apply to become a participant.
All right, newsouls.org. As Mary said, the information is right there if you want to participate. And get your men. We're going to talk in a little bit about why it's so important for all types, shapes, sizes, genders of African Americans to participate in trials. But Dr. Williams, what about you? I know you're working on some specific things in the lupus community. Tell us about that.
That's right. So I'm currently leading a 5-year federally funded study of African-American women with lupus. And what we're trying to do is it's a randomized controlled trial. And I love that Dr. Gaffney shared earlier that there are a variety of types of trials. It isn't always drugs or things that people traditionally think of when they hear the word trials. What I'm doing is considered a behavioral trial. So what we're doing is we're introducing an intervention, which in this case is peer mentoring of African-American women with lupus. And then we're looking at how that intervention impacts their disease activity, their quality of life, and also their healthcare utilization. So in lupus, a large part of the cost incurred has to do with inpatient admissions to the hospital and a lot of emergency room use. So what we're trying to do is help these ladies to manage their illness in a way where we can cut some of those costs for their families, for the healthcare industry in general, and improve how they're feeling overall. So in this study, the randomized piece is that half of our ladies are randomized to be mentored by another African-American woman who has had lupus for a longer time. She's managing her illness well, and she's paired with someone who may be more recently diagnosed or may not be managing their disease as well. And then our second group of ladies is randomized to small support groups that consist of about 4 to 5 ladies. Both arms meet on a bi-weekly basis for a total of 12 sessions. In the one-to-one mentoring group, they cover different topics related to disease self-management, like understanding your medications, effective communication with your providers and with your family members, how to recognize when you're having a flare, how to recognize when you may be depressed. Also, things like spirituality and other coping strategies, exercise, nutrition. So it covers a broad variety of topics to help our ladies manage their illness better. Right now, we are in our 3rd year. We're recruiting our final wave of ladies. We are looking for about 100 African-American women with lupus. It's been incredibly successful so far. We've already seen some preliminary results that indicate a decrease in things like anxiety and depression, decreases in disease activity. And then we have a lot of anecdotal evidence about ladies' just general experience with the program and just appreciating having someone to walk this journey with them who knows what they're going through and has been through some of the same things. So we've seen a lot of successes socially as well as clinically and medically. It's something where because of COVID has not interfered. It's offered remotely to make sure that it's accessible wherever women may be. They don't have to come in for visits. We do all of our assessments online. We actually do the consenting procedure online, and all of the sessions are held by phone or computer, where ladies, we actually distribute iPhones to ladies who may not have a reliable source of communication. And that way they can access these meetings with either their support group or their mentor by phone or by video, using the phone that we provide or using their personal computer. We do compensate for all of the assessments that take place throughout the program. And then we also compensate our mentors because they are trained, and then they give their time to up to 3 mentees at a time. So all of that is included in this program. As I said, we're recruiting now. We will be recruiting through about February. That's when we will train our new group of mentors, and then we'll get the program underway in April of 2021.
Now, do women other than having lupus, do they have to live in Charleston, Dr. Williams, or can they live anywhere in South Carolina?
No, that's a great question. Because we offer it remotely, they can be anywhere. So we actually have ladies who are even outside of the state of South Carolina. So our furthest participant right now resides in Wisconsin. And then, of course, we do have a critical mass here in the Low Country, but all around the state as well.
Great. Please share that information with me after the show so that, I can post it and share it, because this is such, all of you, everything that you guys are doing is so incredible. So we definitely want to get the word out. So Dr. Alexea, why is it important for African Americans to participate in clinical trials?
So the importance of that is because we need to understand, if we're talking about a medication, do we metabolize the drug differently? Are we more prone to have adverse side effects to a particular medication or intervention? For observational trials, I'll tell you about the trial I was in. So I was in a trial to see the timing of cardiomyopathy or heart failure related to the chemo drugs that I was on. These drugs are old. They're the standard of care. And what they were trying to figure out is, at what timing does this occur? And if it does occur, the heart failure, then can we intervene and prevent long-term progression of heart failure? Mm-hmm. And so, and if you have a wide variety of patients, you can have cohorts within a study, and you can say, well, our African-American participants were more likely, less likely, or just as likely to experience a particular side effect or experience benefit of a drug. And then you can start to tease out are there alternative ways in which we should be treating someone? So because we are not often participants in the trial, we don't know why we tend to fare worse when we get the same interventions as our white counterparts. So we have to be involved in order to know. And the reality is when it's a trial that is utilizing the standard of care medication versus something else, you may have some potential gains, but you may be contributing to the benefit of your brothers and sisters for their long-term health and well-being when they get treated for a given disease process or state.
Because is it true that everybody's makeup is different, particularly, I guess, gender-wise and ethnically? So that's why, I guess, just to break it down, it's so important for Black men, Black women, children even, and all ethnicities, to take part in these trials and studies, because to get a better idea of how, I guess, it, whatever the particular trial and study is, affects a certain group, you've got to have that certain group participating. Is it as simple as that?
Yeah, literally representation matters. We know so many just kind of critical things about medications and medication responses. So for a drug like Plavix, for instance, we use in people who've had heart attacks and strokes. There are some people who are Plavix non-responders. This drug may work perfectly and save life and heart and brain and limb for one cohort of people, and there's a small proportion of people who just will not respond to this drug. And so if you found out a particular population was less likely to respond to this intervention, then you would stay away from it. So we know that about certain blood pressure medicines like ACE inhibitors. They may not be as effective in Black people or people of color. We're more likely to have adverse reactions to it. So we go for a different class of drugs more often in Black people and people of color. So if we're not in the trials, then we kind of learn these things the hard way, right? After it's put into practice, it becomes the standard of care. And then it's like, oh, but hold up, this may not be for y'all because y'all seem to be having more of a problem. And it's not necessarily universal. Right. Black people, we may be more disproportionately impacted. So we want to find out, ahead of time if we can.
I'm hoping I can interject with pharmacogenetics. That becomes very prominent also. Mm-hmm. And that's also tied to your race and to your ethnic background as well.
Oh, really? Okay. Yeah. Mm-hmm. So what about, we're in the midst of COVID right now, and, they're out there trying to, find a vaccine, a cure, or something or another. And obviously there is skepticism. And so what's going on with the COVID trials? Do any of you know?
So there's several vaccine trials underway, and I think 10 or 12 really good contenders. I think, and I don't want to get political on your show, and I'm not a political person, but I think like the politics involved is kind of pushing one manufacturer over another. So when my patients come in and they have doubts about, that the fact that a vaccine is going to be on market soon or several vaccines will be available, what I try to remind my patients is this: the notion of vaccinating people is not new. So the scientific community knows how to produce a vaccine. We know what a vaccine needs to do, right? It needs to mount an immune response. It needs to produce immunogenicity, right? Does this vaccine make your immune system respond and prevent this infection? And we can measure that in antibody levels in several other ways. And then, is the vaccine safe, right? Am I going to cause any harm or adverse side effect by giving you this vaccine that far outweighs the benefit? If the risk far outweighs the benefit, then we're just not going to give that. So these are the kinds of things that are studied in vaccine trials: is efficacy and safety. So a lot of these trials are at phase 3, if I'm not mistaken. And there was a halt in one trial, that was the AstraZeneca trial, because someone had a diagnosis of something called transverse myelitis, and it was unclear whether or not it was related to the vaccine or related to some underlying medical condition that the patient had. And this is not like it's exciting, but it's not unheard of. That's the whole point of the clinical trial, to identify adverse reactions, determine if they can be directly linked to the study drug or the study, in this case, the vaccine that's under investigation, or did it coincidentally happen during the trial? And once we know that, then they can bring a vaccine to market. So I also remind people, right, we've been doing this for a long time. We know what it takes to make a vaccine. We know how to mass produce them and produce them in a way that is safe. We just need to know, are we producing a vaccine that is giving a good, adequate immune response to COVID-19? And then you got to do all the myth busting. So I remind people that nobody's putting a microchip in you. This is your microchip in you. It's in your pocket. It's on your wrist. And you can track what you're doing anyway. So they don't need to go out of their way to vaccinate people as a means to track what they're doing. They can do that anyway.
Well, they are doing it. They don't have to. They're doing it.
It's already happening. They don't need a vaccine. Exactly. The needle that I use in my office is big enough to put a microchip. But you have to do all that kind of myth busting as well, when you are getting people prepared for what's coming down the line and getting people to be agreeable or to even be willing to consider this sort of intervention.
Yeah. Is there one place where people can go where they can find out all the trials going on? If someone were interested in participating in a trial, how would they find out?
That, I don't know the direct question to that, because there are so many trials.
Right.
So many trials.
So there's not like trials.com that you can, no.
There is clinicaltrials.gov.
Right, there's clinicaltrials.gov.
But a lot of these trials have popped up very quickly, and I'm not sure if all of them are going to be represented on clinicaltrials.gov. But clinicaltrials.gov is pretty easy to navigate. Somebody could go in there and just put COVID in the search bar, and then see what trials are available, and then use other search terms to try to narrow it down to maybe the area they live in and their age group and things like that. But that might be a good starting place.
Yeah.
Yeah, clinicaltrials.gov. And Dr.
And
Richburg.
there's also another.
Go ahead, Mary.
That's what I was going to say.
Or some, okay.
I was also going to say the NIH, National Institutes of Health, they also have a clinical trial program now where they're actually trying to recruit a diverse group of people, including minorities, for different research trials where you may just complete surveys. And so that website is allofus.nih.gov.
allofus.nih.gov. Okay. And that's another place where people can go to find out about clinical trials. And we didn't mention this, but I just want to throw out there, and many of these are compensated financially. You get something out of it.
Yes.
Yeah. Now you won't get rich, but you get a little something, right?
Right.
Right. Okay. All right. All right, ladies. Thank you so much. Dr. Alexea Gaffney, New York-based infectious disease specialist, Mary Wilson, PhD candidate and project manager for the Nutritious Eating with Soul Study, USC School of Public Health. Pharmacist Dr. Nanci Richburg, Chief of Clinical Services at Salubrius Pharmacy. I think I have that correct. And thank you so much for hanging in. I'm so glad you were able to stay here with us for the last 20 minutes. Dr. Edith Williams, Associate Professor of Epidemiology at MUSC. Ladies, thank you so much for the work that you're doing for African Americans in our community. And I just love a smart sister. I just love a sister with letters behind her name. Thank you, ladies, so much. We appreciate you.
Thank you. Thanks for having me on. Bye-bye.
Thank you so much. All right. So if, again, please contact any of these ladies if you need some more information about clinical trials. Now, if you have a product or service that could help someone cope with COVID, please email copingwithtretailor@gmail.com. We would love to talk to you about being a proud sponsor, just like It Together and our other sponsors, SCDHEC, the City of Columbia Office of Business Opportunities, and of course, Palmetto Media Connections. If you have a story that could help someone cope with COVID, we would love to talk to you also. Please inbox me on the Tailor Made Productions page, and let's talk about how we can work together. Also, coming up tomorrow on Coping with COVID, we're going to talk with the folks with the Richland County Recreation Commission about everything that they've got coming up that can help you and your children cope with COVID. And then on Friday, Faith Friday, we're going to talk to our one of my longtime colleagues, Cy Young. He and I work together in the Raleigh, North Carolina area in radio, and now he's a minister, and he's going to uplift and inspire us. And then Alicia Ziegler joins us on Saturday. She's got a new book called Fashion Faux Pas. If you want to know how to dress and where to dress and what you're supposed to wear, Alicia has got an amazing story of how she has really survived so many things, and she's got so many different projects, Fashion Week and so many things, and we're going to talk to her. And then next week on Tuesday, we're going to find out who's policing the police. We're going to talk to police chiefs and sheriff deputies from several local police departments about who is policing the police. That's coming up next week on Coping with COVID. As usual, I leave you with a reading from Jesus Calling. And today on October 7th, Jesus says, "In order to hear my voice, you must release all of your worries in my care. Entrust to me everything that concerns you. This clears the way for you to seek my face unhindered. Let me free you from fear that is hiding deep inside you. Sit quietly in my presence, allowing my light to soak into you and drive out any darkness logged within you. Accept each day just as it comes to you, remembering that I am sovereign over your life. Rejoice in this day that I have made, trusting that I am abundantly present in your life. Instead of regretting or resenting the way things are, thank me for all circumstances. Trust me and don't be fearful. Thank me and rest in my sovereignty." That's your Coping with COVID for today, Wednesday, October 7th. Thank you so much for joining us on Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. Until tomorrow, I wish you peace and abundant blessings, and remind you, don't forget to wear your mask over your nose and under your chin. See you guys later.
Coping with COVID is brought to you by the South Carolina Department of Health and Environmental Control. Visit scdhec.gov for an updated list of testing sites and important information on how to protect yourself, your family, and friends from the coronavirus. SCDHEC, healthy people, healthy communities. Also, the City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Log on to columbiasc.net/OBO. Agape Counseling and Training Center. Call 803-779-2777 for licensed professionals of counselors and social workers helping families, engaged and married couples, and individuals of all ages gain an understanding of all aspects of their life. If you're having a challenge coping with COVID, contact Contact Agape Counseling and Training Center at agapects.com. And Columbia Housing Authority. The agency is looking for stories from former residents of Allen Benedict Court to retain some of the property's rich history. In its 80-year life, Allen Benedict Court has been home to some of the country's elite, including a Grammy Award-winning performer, corporate executives, national television celebrities, a host of doctors, lawyers, and NBA greats. So share your pictures, mementos, and memories at chcares@chasc.org. Coping with COVID, brought to you by the South Carolina Department of Health and Environmental Control, the City of Columbia Office of Business Opportunities, Columbia Housing Authority, Agape Counseling and Training Center, and Palmetto Media Connection.
Coping with COVID with Tre Tailor.